So you have a pulled hamstring or a patient that has a pulled hamstring and you want to know how to heal it quickly or to the best of our ability. So the patient comes in and describes having a pulled hamstring, and they touch the back of their leg. They explain what happened. It usually happens from sprinting or jumping off of a curve or something like that. So if we look down here, we know that the main muscle that usually is injured, the hamstring that's injured, is going to be the biceps femoris, right? And the biceps femoris is the most explosive muscle of the hamstrings. It originates on the ischial tuberosity of the pelvis, and of course it inserts on the head of the fibula. So we know that. But it is the most explosive, and it's almost dead center of the back of the leg. And we can use superficial gliding, get deeper into that tissue. We can use a lot of Swedish strokes to warm it up, and I recommend that. But what I find that helps it to heal the most, to help this muscle heal the most, is transverse or cross fiber friction across. And you're saying, well, how am I able to do that? Well, I got an easy method of how to reach those fibers, and you'll know you're right on top of them. What I like to do after, again, you warmed up the muscle, we did all the work by getting, all kinds of pressure in there, is I like to take my knuckles of my hand and place it flat on the muscle itself, not in the popliteal space, but right as close to possible to that back of that knee there, and feel where those fibers are hypertonic, and there always will be. They'll be super tight right in that area, especially after injury. You might even see some heat on the muscle there. Once I apply that pressure, ischemic pressure, because I'm going to be pumping on and off to drive blood into that tissue, I'm going to raise the foot like this. I'm going to raise it up. And then I'm going to move the foot towards the mid-sagittal plane, or the dead center of the body. When I do that, if you look, the hip opens up, or we call externally rotates. So the hip is opening up, and when I pull the foot towards me, away from the mid-sagittal plane, then we close the hip, or internal rotation. So it's external rotation, internal rotation of the hip. And the foot does the opposite, so it confuses a lot of the individuals. But we want to just make sure that we go back and forth like this. I don't recommend this. There's too much stress on the knee itself. We want to make sure it's at a 90-degree angle. So I apply pressure, internal and external rotation, and then I simply move the handle about a ½ inch, and I do it again. And I move it a little bit. Now I'm going to go back and forth over that muscle all the way up until I feel that ischial tuberosity, or as close to it as possible, as I'm working that hamstring all the way up and down. And you can just draw an imaginary line, and you can feel those fibers popping underneath your knuckles of your hand. You can use the palm, but I find that it's not enough pressure. It's a powerful hamstring. Now this is going to hurt your patient. They're going to feel some pain when you're doing this. So it's good to make sure that that muscle is really warmed up when you start this process, because what we want to do is we want to settle down the mechanoreceptors, right? We want to settle down those nerves that feel that pressure and think there's a threat to the muscle. Once they get used to it, then you can apply more and more pressure. So you're going to work this cross fiber friction at least 5 to 8 minutes. Back and forth. You've already done maybe 4 or 5 minutes of warm up on that tissue. So you're going to be spending 10 minutes just probably in this area alone. But by doing that cross fiber friction, do it about 3 days a week, with about 72 hours in between, you're going to really speed up the healing of that particular hamstring, and that patient's going to feel a whole lot better.